Good morning. I'm Dr. Latiff. I'm the local pediatric urologist and I form part of Rio Grande Urology. As the pediatric urologist, I handle the majority of the circumcisions done in these young boys. You are here today because you want your child circumcised. We gather this clinic once a month specifically to evaluate and process children whose parents want them to undergo circumcision. There are various reasons why a parent would want the child to undergo circumcision. It could be religious, it could be medical, it could be secondary to hygiene. There may be true medical problems that require circumcision. Either way, we are going to evaluate your child and give you our best opinion as to the best way to manage your child. If, however, what you want is your child circumcised, we will do our best to arrange that. Circumcisions are done on Thursdays. I take all my children to an ambulatory surgical center. This makes the processing and the care of the child more simple and readily accessible for the parents. The child and parents are brought into the preoperative area. There, they are evaluated by a nurse and anesthesiologist. I will answer your questions. From there, the child goes to surgery. The child will be placed under general anesthesia by the anesthesiologist. We will do the surgery. During the surgery, we will inject the base of the penis with some numbing medicine. This will make waking up a lot less painful for your child. We will also place a gauze around the penis. This gauze is part of the local dressing. The gauze may fall off on its own. If the gauze falls off on its own, you do not need to worry about that. It is unnecessary to try to reapply it. If the gauze, however, has not fallen off by the following morning, I want you to remove it early the following morning. The gauze is wound around the penis and finishes in a little point in the back. I want you to grab that gauze and unroll it in the direction of the clock. It is very important that you do not delay removal of the gauze, as this will make it a lot harder to remove the gauze. We will also prescribe an antibiotic ointment for the child. I want you to apply the ointment every day, 3 times a day. This will help in healing. The child can potentially have some bleeding. If the child does have some bleeding, I want you to apply some Vaseline on a gauze or a towel. You place the phallus up against the child's abdomen and you hold gentle pressure. If you hold gentle pressure for about 10 minutes without looking, that should control the majority of the bleeding that your child will have. If the child has any problems, please do not hesitate to call us. We are here to take care of your child. Pain medication is usually handled just with acetaminophen and ibuprofen. I do not give prescription for additional medication. The vast majority of the children do not need it and they do well. Pain, however, is a very subjective matter. I have children who 2 or 3 days later are running around as if nothing had been done. There are other children who 2 weeks later come in to see me still in a lot of pain, walking like they just got off a horse. I cannot tell you which one of your children will react in one or the other way. Most of the children do very well. We will see the child in our clinic 2 weeks after surgery. If there are any problems, please do not hesitate to contact us. We will be glad to bring the child in if there are any problems or you suspect that the child needs further evaluation. Most children do well, and we look forward to taking care of your child.